Hi friends, today I am going to talk about sciatica and slip disc. There is a lot of confusion between sciatica and slip disc. That is why I have made this talk. So what is sciatica? Sciatic nerve is the largest and the longest nerve in our body. Whenever there is a pressure on that nerve, it causes thigh pain, calf pain, tingling sensations, numbness along the thigh, calf and up to the foot. So what is slip disc? As you know, our spinal column is made up of vertebral bodies which contains disc in between two vertebral bodies. The disc acts like a shock absorber. It is outer layer is made up of hard structure and internally there will be jelly-like substance. For example, everybody would have achieved chewing gum like center fresh. So when you bite the center fresh, it usually is hard outside. As you bite it, there will be a liquid kind of a thing which comes out. In the slip disc, that liquid kind of a thing comes out and presses the nerve. That is called as slip disc. So once the disc slips out and presses the nerve, it increases the nerve pressure. Because of the nerve pressure, patient will have localized back pain or sometimes thigh pain, calf pain, and also some muscle weakness can develop, and he also can develop some neuritic symptoms like loss of bladder control and little paralysis of the foot and ankle muscles also. So the main thing is slip disc can cause sciatica, but sciatica is never slip disc. This point everybody I want you to understand. And sciatica pain is usually relieved within 3 to 4 days when you take rest, take some muscle relaxants and do some stretching exercises. Slip disc can be a permanent issue if it is not identified early and treated appropriately. If it is neglected, the disc will become hard and presses the nerve, which results in some permanent disability, and it will usually have some recurring back pain and leg pain which patient usually comes with. So early identification of slip disc and correct remedies is very important to treat the slip disc also. Thank you.